Thank you so much for joining us today. My name's Jen, and I'm going to be the moderator of this conversation. If you're unfamiliar with our platform, the EcoL is a cosmetic science platform where we give a voice to scientists and other experts in and around the cosmetic space. And for this panel, it's going to be a beauty science panel about all things skincare in conversation with Dr. Anke Ginzburg. She completed her PhD in analytical pharmaceutical chemistry. She worked in active ingredient extraction, testing, quality assurance, formulation development, and science communication, and she's an active volunteer with the Society of Cosmetic Science and visiting lecturer for the Masters of Cosmetic Science at London College of Fashion. Eunice Cofie-Obeng is Chief Cosmetic Chemist at Novakovich, an innovative skincare company for people of color. She holds a Master's of Science with an emphasis in cosmetic science, completed training as an esthetician, and completed the Harvard Kennedy School of Government Global Leadership and Public Policy Executive Education Program. Liah is an entrepreneur and content creator based in New York City. Liah is one of the top beauty influencers with more than 1 million subscribers on YouTube. She's the founder and CEO of Crave Beauty, a skincare brand that sets out to liberate people from the stress, confusion, and a whole lot of overwhelming skincare advice. And Andy Millward is a UK-based facialist and practicing corneotherapist with a passion for holistic skin health. Andy also works as a skincare brand educator and has previously worked as an educator teaching the CIBTAC level 4 diploma students. That's a mouthful, wow. And then finally, Dr. Ranella Hirsch is a frequently quoted authority in cosmetic dermatology, called an expert derm by Allure and a beauty guru by Mary Claire. Dr. Hirsch is the past president of the American Society of Cosmetic Dermatology and Aesthetic Surgery and co-founder of Atolla. So I'll just dive into my first question, and I thought it would be interesting just because there are so many different skin experts out there. What are your skincare routines? What do they currently look like? And because Ranella volunteered earlier, Ranella, maybe we could start with you.
Sure. I think most people are really surprised to hear that, like many dermatologists, my skincare routine is incredibly boring. It's very much based on where there is data. So there's kind of the core tenet of protection with sun protection, sunscreen, using a retinoid or a vitamin A product. And really everything else that I do, depending on whether I'm traveling or at home or whether I'm, in a climate that's hot or cold or humid or dry, is based on supporting that. So the variables for me are really only the things that allow me to get excellent sun protection and good use of a retinoid product as well.
Liah, do you want to go next?
For sure. I mean, my routine is also flexible, so I don't really call it a routine, but more like a skincare practice of the day, according to what my skin feels. But recently I've been experimenting a lot of vitamin C serums, and there's not a lot of ascorbic acid-based serums that my skin really agrees with, unfortunately. So I've been trying out a lot of vitamin C derivative serums. So that's something that I've been enjoying so far. And I finished it off with a skin barrier nourishing serum. So something that's cocktailed with ceramides and, cholesterol and all the fatty acids that my skin enjoys, and always a broad spectrum SPF.
Anke, do you want to go next?
Yeah, it's going to be incredibly boring in line with what we've already heard. My skincare routine really focuses on prevention and protection. So anything, and I've had more or less the same skincare routine for a couple of years now. I changed it when I was in my late 20s. But at the moment, I make sure I cleanse in the morning and in the evening. I use a treatment serum, and I'm not very loyal. I change them up depending on really the time of year and also what my skin is going through at the time. I have really, really oily skin. And I always use a moisturizer, and I always use a sunscreen during the day. And I must say I'm quite experimentative when it comes to my nighttime routine. I like trying new things. I do always go back to a retinoid though. more or less.
Eunice, do you want to go next?
Sure. So my skincare routine is actually pretty simple as well. I have acne-prone skin, so I've been able to control that for many years. And so I typically use products that have ingredients from Africa, like baobab oil or marula oil. I love hyaluronic acid. I also love mandelic acid as well. And so I try to use products that have that because those typically work well with skin of color. And I love sunscreen with an SPF of at least a 30.
And then last but not least, Andy?
Yeah, similar here really, a fairly kind of basic stripped back regime. It hasn't always been that way, actually similar to Eunice. Actually, I've got a very acne prone skin. So one of the things that I've kind of learned over the years is that actually my skin doesn't fare well with too many products, too many layers. So I tend to focus on quality rather than quantity of product. So again, very basic during the day, a cleanser, an antioxidant serum. I actually skip moisturizer in the day. I'll use more of a moisturizing sunscreen and just make sure that I'm applying that adequately enough. But if I try and wear a moisturizer during the day under my sunscreen, it's just too much for me personally. And then in the evening, again, cleanse, usually generally focused on a retinoid and then a moisturizer. Although bearing in mind, you know, as a facialist, I have to kind of test out new things occasionally and see what if there's anything new that I want to introduce into clinics. At the moment, I'm testing out a growth factor serum system rather. So the retinoids have kind of taken a bit of a back step, just so I can kind of really see what the growth factors are doing. But pretty much that's what my core regime would look like.
So to all of our audience members, just so you know, this conversation is going to be published afterwards on our YouTube channel. So if you missed anything prior to right now, or if you have to step out early, then no worries, just come back and you'll be able to retune into this YouTube video. And also, if you have any questions, then leave them in the chat and I'll be able to ask your questions throughout, probably towards the end, but if there's anything fitting with what we're talking about, then I'll ask them a bit earlier. But my next question for you guys are, what are the common skincare mistakes you see people make? Anke, do you want to start?
Was I randomly selected?
Randomly selected.
So, well, I don't see clients. I'm not a facialist. I'm not a dermatologist. I don't work in a public pharmacy at the moment. So what I see is happening on social media. And what I used to see when I was working in communications, where we sometimes had to prepare responses to consumer complaints, or also working in quality assurance, seeing consumer complaints, a lot of what I see, what causes people grief when it comes to the use of skincare products is that they're actually not using the products correctly. So I can't speak to people don't use sunscreen or people don't do this or people don't do that because simply I don't see people. But from what I can tell you people definitely do wrong is they don't read the label, or if they read it, they don't stick to what's written on it. Very recently, I'm sure everyone who's a little bit more into the skincare scene has seen a certain acid serum of a specific brand that came with the advice to use it only when the skin was already accustomed to acid products, and also to only use it for a certain amount of time. And a lot of people apparently didn't use it the right way. And that is something, long story short, that I see across the board, not only in skincare, using your face products on your body, using your eye products somewhere else, using, a peel for the body in your face, leaving products on longer because you think that you can expect a better result from them using them more frequently. Also, my pet peeve, using dropper pipettes, not to dispense product into your hand, but putting the pipette directly in contact with your face. that's not how the product is intended to be used. So from my perspective, the majority of mistakes that consumers across the board make is that they don't read the label and they don't use the product the way it's written on the label.
Liah, do you want to go next?
Yeah, absolutely. I think the approach that more is better is definitely one of the biggest skincare mistakes that we do see across like literally everywhere. I think especially if you do have skin problems, you're so desperate to clear up your acne or other skin problems, whether that be, you know, or rosacea or eczema. So you tend to fall in that vicious cycle of overdoing skincare and to find the perfect skincare routine, obviously. So the intention is good, it's genuine, but at the end of the day, you are abusing and attacking your skin even more. So that, and I think what is pretty related to that subject is that the more or the higher concentration is always going to be better. Now we see so many great, you know, like ingredient driven products out there nowadays. And I think it does give people the illusion that the higher concentration means that it's going to deliver better results. So sometimes, you know, even prematurely, like teenagers would jump onto a very high dosage of active ingredients, which they might not need yet. And without any consultation, without, you know, visiting an esthetician or a skin expert like a dermatologist, they jump onto it a little bit too early. So they do more harm than good. I think that's the biggest trend, unfortunately, that I've been seeing a lot. And I think the industry is becoming a little bit too efficacy or too results driven, like seeing more harsher products here and there is a little bit, yeah, upsetting.
Eunice, do you want to go next?
Sure. I believe that baseline, not knowing your skin type or what skin issues that you may have is one of the biggest pet peeves of mine, because you know that typically dictates, you know, what types of products you'll use on your skin. So I see a lot of consumers not really knowing or understanding the skin that they're in. And many of them are not seeking professional advice from a dermatologist or an esthetician. And going back to what Liah said, you know, the usage of multiple products, you know, I believe in keeping it simple. You don't need 12, 13, 14, 15 steps to get the skin that you want. And a lot of times using 12 different products can be contraindications to one another. So I definitely believe that a lot of consumers are overdoing it.
Andy, do you want to go next?
Yeah, I'm just going to reiterate what Eunice has just said. Actually, a big thing that I see is people not really understanding their own skin type and what their actual skin needs well enough. If I, you know, the amount of times I'll have a client in for consultation, and one of the questions on my form is asking them what their perceived skin type is or what their skin type is. And 9 times out of 10 people will get it wrong. And when I'm doing a Woods lamp analysis to identify exactly how much oil is present in the skin, or you know how lippy dry or how dehydrated the skin is, the amount of people that will tell me, and they will swear black and blue that their skin type is oily, and then under the Woods lamp they're actually more on the lippy dry end of the scale. But there's other things that are making their skin appear shiny, and they perceive that as oil. But that lack of understanding or their misdiagnosis of their own skin type to begin with sends them on a complete wrong path of buying the wrong products, which then don't get the result that they're looking for. They then jump from one product to another product, and it spirals into using far too many products, or you know, product hopping because you're not actually giving that product long enough to work, and it was probably the wrong product for you in the first place because you've completely misdiagnosed your own skin. So yeah, that's another big thing. And what Liah was saying as well is overusing things, especially when it comes to exfoliating products like acids and things. Again, I approach everything from a corneotherapy, from a skin barrier health perspective. So skincare should always support our skin's natural function. It should always support our skin's barrier integrity. And what a lot of people are doing, it's almost like they're trying to replace what the skin should be doing by aiding its, or doing the exfoliation for it, when actually we should just be aiding the skin's ability to kind of shed itself. So it's misdiagnosis of your own skin type, and then falling into the route of overusing things, particularly the wrong products.
And then finally, Ranella.
Sure. I mean, as a dermatologist, I always say to patients, there's really two ways to go wrong with skin products. You can use the right products the wrong way, or the wrong products the right way. And I think touching on what every one of these people have said really is encompassed in that statement. Completely agree with Liah. The questions I get about how can I layer this, and I think the surprised answer for me of why would you want to? Because it just rarely offers benefit. The only one thing I would add from the medical side of things is we often see products not given an ample time to work. There are active ingredients that are wonderful, and someone comes in, well, I've been using it and it's just not doing anything at all, and I'm really not seeing anything. How long have you been using it? I've been using it for 9 days. And the problem is that at some point, the skin is very, very effective at keeping things out, not so much the getting things in. And what is really the variable of whether a lot of things will work is time. So for me, the two big pet peeves are using too many things, and for those right things, not giving them enough time to actually do what it is that you need them to do.
Now, I'm sure you have seen some outrageously priced products out there. For example, a few months back, an unnamed brand had a hyaluronic acid serum for $800, 100 milliliters, $800. I know. So are we going to get more out of products like this? Do we have to be spending so much for our skincare products? Is there a benefit to using these products compared to, for example, a drugstore product? This is maybe an unpopular opinion. I find, at least when I post things like this, people get angry with me. But I'd love to hear your insights for this. How much should we be spending on our skincare? Are we going to get more results from more expensive products? And is there something wrong with drugstore products? Andy, since you've been last a few times, or second last, do you want to go first this time?
Yeah, so I have very mixed feelings about this kind of question, and actually it's obviously something that crops up a lot. I think there are always going to be exceptions to the rule. Similar, an example there obviously would be the really mega expensive hyaluronic acid serums and moisturizers that are based on a specific type of algae, and there's always going to be that luxurious or supposedly luxurious market of creams and potions that are within a department store, which probably don't really perform any better than something that is in the drugstore. But on the other side of that, again, we also can't really expect products that are of a certain lower budget to perform as well as all products that are going to be, a little bit more expensive. There's again, people like Anke will be able to kind of go into this in a lot more detail than I can, but there is a lot more that goes into formulating a product than simply the raw ingredients. So to actually get a product to perform really well, it's not just a simple case of throwing ingredient into a pot and giving it a stir. There's a lot that goes into that. And, more sophisticated technologies, more sophisticated ingredients, trials, clinical trials on the end product rather than the raw ingredient. All of this costs money. And for us to say that, a really expensive skincare item is going to perform the same as something that costs, £5 or $5, I just don't think is accurate. And then if we give that message out to the end consumer, it creates almost like a distrust, I guess, that people are going to be really skeptical. It's like thinking that everything that is over a certain price point is literally just there as a con to get money out of people, when actually that's not the case.
Eunice, do you want to go next?
Oh yeah, most definitely. So I agree with Andy. Definitely, he hit a great point in reference to the pricing. I think that some consumers may feel like great skincare is out of their reach. when there's excessive pricing on products. But I also agree with Andy in the fact that a lot of these products, it does take a lot of time. It does take a lot of different ingredients that may be very rare. And so that can be contributed to the high price. I always like to say, let's look at the ingredients. Let's look at the delivery systems, because that will dictate whether how effective the product can work. Also looking at, clinical trials or any sort of anything clinical testing that can show how effective these products are, not just on the macro level, but also seeing what it looks like on a cellular level as well. So I definitely feel like the $800 product, it may not necessarily be the best product for the consumer. It's all about what type of results these products, whether it's $5 or $800, can deliver. My own personal story, dealing with acne in my 20s, I was using a lot of drugstore products, and I just didn't find that they worked well for my skin. And so when I went to an esthetician and actually got a product that had the ingredients and the delivery system that would be suitable for me to care for my acne, I saw different results. So it's all about the active ingredients that are used, the delivery system, how it's formulated, and that dictates the quality or the results that you'll get from a product.
Anke, do you want to go next?
Yeah, I think Andy and Eunice have covered quite a lot of the key points. My main message would be that there is no yes or no to is expensive always better, or is more affordable always worse. I think it really depends also on the expectation of the consumer. There's a lot of things that drive the price of a product. The cost of the raw materials is only one, and the development time, as Eunice said, is another one. Packaging is a massive driver of cost. Let's not forget this. So if it's a very luxurious feeling product, if it's metallized, if there's an elaborately designed label, and I'm sure Liah, as a brand developer or brand owner, will be able to corroborate that. Packaging can be very expensive. And then what drives you, or what drives the consumer to buying the product, obviously also sets the price when the marketing team that develops the product sets the actual target cost for it. And cosmetics are there to have an effect on the skin, of course, but let's not forget that they, for many consumers, are also lifestyle products. So I know Ranella and Danny and Andy, you're going to probably disagree with me here. So this is not gauged to your area of expertise, but many consumers, they buy cosmetics for lifestyle, and for them, being able to afford a certain product is a certain status symbol. For them, maybe this is the right product because it makes them feel good about themselves. Maybe this is the product that gives them the best effect on their skin. From a technical point of view, there's different types of ingredients or different quality types of ingredients that can drive the cost. So you can buy hyaluronic acid for $300 per kilogram, even more probably, or for much less. It depends on how the ingredient is processed and also how it's purified, etc. So long story short, I will say that again and again to just interrupt myself from talking, but it really depends. There's a lot of different aspects, and you just can't say, expensive is always going to be better, cheap is always going to be worse. There's a whole gamut of factors that go into that.
Ranella, do you want to go next?
Yeah, I wanted to piggyback on what Anke said and lovingly disagree. Don't underestimate the enjoyment factor for a dermatologist. It's really, really important that someone like doing or at least tolerate doing what I'm asking them to do, because otherwise they're not going to do it. And nothing has ever gotten better with a product in a jar. So, I mean, that's really critical. The other element I will just throw out there is I think you can accomplish pretty much anything in the skin at just about every price point. So a big point that I like to talk about in consult is what is your skincare budget? Where would you like to be? And then where do we devote the amount of each section, for example? So for me, spending a tremendous amount of money on cleansers is probably not something I think you need to do. Probably not something you need to do for great sun protection. Where do you want to put your dollars? You want to put your dollars where the ingredients are that have the real opportunity to impact change and improvement in your skin. And I see Liah nodding. I think she's going to agree that it's really about having ingredients that are in things like serums, where your actives are. That's where I want you to put your skincare dollar. So for me, it's not even so much about total budget, but how you apportion that budget to do it smartly. And I feel like with that as a guiding mantra, you can really come together with great skincare at just every single price point. And I've helped people to do it with each. Liah, you're nodding. Is that?
Liah, do you want to go next?
Yeah, I think everyone here covered it pretty perfectly and beautifully. So it really is not so black and white like everyone has said. I think for me, if it is expensive, I need to be logically convinced by the brand, by the company, of why this costed this much. If it's an $800, like, what is the delivery system that's so unique? Have you used an ingredient that is so scarce that it's really, really hard to, I don't know, harvest or to source? And is it the specific technology that it is required throughout the entire manufacturing process? I think as long as the brand or the company can convince me in a very logical way and justifies why it's so much, then I think I would be investing more into it. So I don't think it's true that expensive products are always better. But also at the same time, there is a place when some expensive serums like vitamin C serums or retinol serums that does require a little bit more sophisticated delivery systems or technology, I think that's definitely a spot where I would invest more in.
Now, Liah, you and I had a conversation. Stay tuned, everyone. It's going to be published on our podcast shortly, where you brought up that there are some grand expectations for skincare based on a lot of the marketing that consumers are exposed to. How much can we really get out of our cosmetic products? And I think it's also maybe important for people to understand regulations, and maybe wanted to talk about medical grade skincare claims. So what are the different types of products for regulations? We've got cosmetics. How much can they do, over the counter products and prescription products? So I guess my next question is, how much can we expect to get from our skincare products, cosmetics or otherwise, maybe OTC or whatever? Liah, since you went last time.
Sure. I mean, like what Andy has mentioned in the first question, skincare can only do so much, and skincare should really exist as a supplement to nourishing and supporting your skin's natural ecosystem, the natural functionality, the skin barrier system that your skin is so good at keeping things out and protecting your skin from, not losing hydration. I think there's so much of that. I feel like it may have to do with the US or the North America healthcare system, unfortunately, because the barrier to visit a dermatologist is so high or not so affordable. There's an expectation for just over-the-counter skincare products in Sephora or in Ulta or in drugstore to deliver that almost like clinical results, that they do see visible results right away. But at the same time, going back to your skin can only absorb so much. Your skincare products that you are applying on a daily basis can't really penetrate deeper or even like beyond the surface level of the skin. So I think it's really important for us to understand that skincare is there to support. So let's just lower our expectations a little bit and just enjoy skincare. Don't make skincare something that controls our life. I think that's what I've seen happening a lot of times.
Does anyone want to go next? Any takers?
Sure. First, I think it's important that we define the three different sects of the FDA regulated products. So one is your cosmetic products, and then two, you have your OTCs, and then three, you have your prescription drugs. So all of those have different variations in them and how they can actually work on the skin. So for instance, your more cosmetic based like skincare, you shouldn't expect for any type of physiologic changes to take place in the skin. And it's actually against the rules of the FDA for a company to make those types of claims. OTC drugs typically have limited amounts of actives that can be formulated within the product, and you may not see very much physiological change. Some of those OTCs may have once been prescription drugs, and they've been able to do the prescription OTC switch because they have long-standing studies that show that the product actually does work very well for the skin, and there have been very low levels of issues with that product. And an example of that is Defrin. And then you have your OTCs, which are you would find your tretinoins that are more active vitamin A. And then you may see some other prescription drugs that can address other skin issues, such as acne or seborrheic dermatitis. And so I wanted to lay that out so that consumers can see there is a difference in each. And they're regulated differently, and then also they are formulated differently, and you'll see some different results from that.
Andy, do you want to go next?
Yeah, so the question was what we can expect to achieve, or what we can expect from topical skincare, right?
Yeah.
Yes.
So, I mean, approaching this obviously as a facialist, I don't have access to prescription medications. It's not something that I can give out to my clients. So the only things that I have in my toolbox, in my arsenal, are effectively cosmetics. And given the right product to the right person and used in the right setting, I think we can actually achieve a hell of a lot with over the counter with cosmetic skincare. But it's getting as I said, it's getting the right product with the right person. And this is where it all comes back down to correct diagnosis of skin type, understanding what that skin needs in the first place, and using the right products to be able to support that skin's own natural function. So, whether it's focusing on strengthening the skin barrier or whatever it is. But actually, I think we can achieve, you can achieve a lot with cosmetic skincare. I've, and managed to achieve really good results with my clients. So if all skincare was not able to achieve results and we were just heavily reliant on prescription only, then we wouldn't be able to see the results with over the counter at all. Of course, there is a limitation though, and I think one of the things that the consumer has to understand is that actually there's a lot going on underneath the skin as well. So we have obviously the fatty layer, we have muscle, we have connective tissue, we have bone structure. So there's only so much, particularly say, if a client's looking for skin tightening or line, skincare to plump out deeper lines. There's a lot going on underneath the skin that a skincare product is never going to touch. So skincare should always be used in complementary with other things, but actually, the right skincare and the right product on the right person, you can actually achieve quite a lot.
Anyone want to go next?
I will, because I want to just jump onto what Andy said, because certainly I think of skincare as critical in the maintenance phase, kind of keeping it. But what I haven't heard yet is, and I think you're all going to nod as soon as I say this, just how much what I do, and I'm thinking Andy as well, is repairing damage people have done by using the wrong product or using a product the wrong way. And because so much of what then skincare has to do is reparative, getting it right and getting the right skincare on board really does a lot. The skin is an incredibly smart and efficient organ. And when you get in the way of it doing what it does best, you will have problems. We are seeing so much reactive dryness, reactive breakouts, reactive, you name it right now. And, you know, people have had more time. People have not had easy access to professional care. You can't go in and see an esthetician right now in many places. So with using products incorrectly or using them too long or using them with too many other things, as I think everyone has alluded to, you create a lot of problems that then become themselves things that get treated. So I think we shouldn't underestimate how really important it is for good skincare to keep the skin in its best health. And that is actually not unimportant. So I think that alone gets its own kind of marquee for what skincare does. Keeping skin healthy is banner worthy in my mind.
Who wants to go next?
I'm happy to. I think yeah. Am I interrupting anyone? No? Okay. I was heavily nodding when I heard what Ranella says, because cosmetics and your daily skincare routine can achieve a whole lot when it comes to keeping the skin in good shape. And if you look at the definition of what a cosmetic is supposed to do in the EU regulation, is that it is actually supposed to keep your skin and all the other integumentary system parts of you in good shape and in good working condition and in, you know, good looking, good smelling condition. That's what a cosmetic does. And if we think that, I know in the US the regulatory situation is different, but here in Europe, SPF is a cosmetic, it's not a drug. So using your SPF daily will keep your skin in good condition. Using a moisturizer will keep your skin in good condition. Cleansing will keep your skin in good condition. So keeping all of this in mind and thinking back to what we all said about across the board, what our skincare routine basically looks like, skincare routine, including these steps, definitely keeps your skin in good condition and helps you to maintain a good skin barrier, which then in turn, you know, will not lead to what I presume a lot of customers or consumers then try to counteract, as in premature signs of aging, pigmentation issues, skin irritation, and barrier function issues that translate into multiple other issues. So when it comes to the question, what can we actually achieve with our daily skincare routine? We can keep our skin in great condition. And that includes a few basic steps. And if we do that, then we probably don't need to worry too much about a lot of other things that come further down the line, which then probably can't be addressed with purely cosmetics anymore, but need a more intense intervention from either a facialist or for OTC medication, or a dermatologist if it translates into a medical condition. What cosmetics don't do is cure medical conditions.
And I guess along these lines, a common qualm that I hear with dermatologists for cosmetic products or even OTC products is with the marketing on them, especially around, like, it's very shady. Obviously, you can't make therapeutic claims, but you can kind of you toe around the line to insinuate something to the consumer. So for someone who has acne, they might try so many different products and then they get really upset because it just doesn't work. And they prolong the time prior to actually getting treatment for their skin condition because they have this feeling that their cosmetic products will be able to treat it. So I guess my next question is for Andy and Ranella. Like, when should people, instead of just opt for skincare, seek professional treatment? And maybe you can even share some of your thoughts about what I just said. Maybe you disagree with me, or maybe you agree, but what do you think? Ranella, do you want to go first?
Sure. So the analogy I typically give to patients and people that I'm talking to is a lot like getting into shape, right? Like you can take up a great plan of running and you learn how, you buy your sneakers, you sort of get better, you keep it going. And there's a lot of analogies to skincare with exercise. I use it all the time, you know, sticking with it, getting better slowly, all of those things. At some point, you hit a wall. At some point, what you're doing isn't working anymore. At some point, you're finding that you're bored with what you're doing. It's just not motivating you anymore. And that's the time that I think it's really wonderful to bring in the professional who can come in. And I think, again, people might be surprised. And I think Andy and I share this philosophy. It's not about having you come in and throw away everything you've been doing. It's just about helping you with the knowledge we've attained to use what you've got and maybe show you in some cases just how to use it a little bit better or more effectively, or maybe try this and maybe do this a different day, or maybe use this less frequently, or maybe if we add this, it'll really buffer what you're doing here. I think people sometimes have this idea that you're going to come and see someone like Andy or myself and everything is going to be thrown out the window. And that's just really not accurate. I think even for people who don't have a formal diagnosis, like you were saying, Jen, you know, of a classified form of acne or what have you, people know if they're breakout prone, people know when they're producing a lot of oil. So it's very rare. And we ask them that. We ask you when you come into that first consult, please empty the medicine cabinet, bring it in a bag or take a good picture so we can talk through what you've been doing, what you like. It really helps me because I can start to understand, well, what's something texturally that you're going to like? What's the kind of lather that you like? Are you a wipe-on person? Are you a wash person? Because again, it comes back to what I was talking about earlier with compliance. If I'm not going to give you something that you're going to use, I've done nothing. So at the end of the day, I think where the pros come in is in that ability to refine. I don't know that everybody needs to start with one of us. In fact, I think it would probably be an inefficient use of money and time. And also because a lot of good education is out there and a lot of good product is out there. But I think when you're finding that you're just not getting to where you want to be, that's where someone like Andy or myself, I think, can be of the greatest value. Andy, does that work for you?
Yeah, the only thing that I would kind of add to that is I think if somebody can afford a consultation with a good, you know, facialist or a dermatologist, actually it may save them a lot of time and a lot of hassle in the long run. So even if they can't necessarily afford clinical treatment, or they can't necessarily afford clinical or cosmeceutical type brands, at least if they have that prior understanding of their own skin and what it needs to begin with, it can save a lot of you know, buying the wrong product and going down the wrong path. Kind of going back to what I was saying earlier, a lot of people don't really understand their own skin well enough. So if they can just, even if it's just to go and have a quick skin analysis and understand their skin better, it may save them a lot of hassle a lot further on down the line. I think another point that Jen mentioned there in the questions was about what topical products can do in terms of treating medical conditions. And if we look at acne as an example, I think there is obviously acne is a bit of a grey one when it comes to skincare and treating acne, because your lower grade acne actually can respond very well to over-the-counter products. But then particularly what I would see a lot in clinic as well, and again, this may be just unique to the UK and the way that our health system works here, because it's not as easy to just go and see a dermatologist unless you're paying privately. You know, you have to get referred by a general practitioner and then go, which can sometimes take many months, particularly in the Midlands where I'm based. One of my clients told me that they were actually on a 9-month waiting list to see a dermatologist. So it will vary from place to place. But the general practitioner may not necessarily have the knowledge and understanding of skin, and they may not, or in the detail, of course, that the dermatologist will have, but they also don't have the time to ask the right questions at their consultation. They have literally a few minutes with their patient. Now, I'll take an hour with consultation trying to find out exactly what went wrong and when. I refer to it as the timeline. I always like to put a timeline as to when the condition started, what were you doing 6 months prior to that, was there anything else going on at the time? Now, what I tend to see a lot of is what I would class as it's not a true acne, it's an acne-like symptom that has been created by using the wrong skincare. So if we can create a problem with skincare, we can also fix a problem with skincare as well. So in that case, I would argue that actually there are some grades of acne and there are some acne-like symptoms that actually we can really fix or address well with topical skincare.
So I'm just going to skip past the next question because we're running a bit short on time and we did get a lot of questions from our audience. But my next question is around, there are so many myths out there, top skincare myths. And maybe I'll just start with one of my own that drives me crazy. People, and this speaks to Anke's post, sorry if I stole your answer, Anke, that I shared, I think yesterday, around ingredients, cosmetic, or consumers looking at ingredients on labels that they are not necessarily sensitive to, and then assuming that, for example, seeing a silicone, because that's a bad word, is going to be bad in a formulation, and assuming that like alcohol, for example, is going to be bad in a formulation for their skin, and not understanding, I guess, the complexity of the formulations, because it all just really depends. It depends on how it's incorporated into a formula. It depends on, I mean, so many different things, and there's a reason people go and study cosmetic chemistry. It's just a little complex, but that's my own myth that I wanted to add in there. But does anyone else want to contribute their own myths that they see in the zeitgeist for skincare?
That was mine.
Okay. Do you want to add anything to what I said?
I was literally going to break in and say the myth that an individual ingredient automatically translates into what the product is or does. That is just wrong. That's just not how it works. An ingredient is not equaling a formula. So once you put an ingredient into its context, it can completely change its properties. And what you see on the INCI list is intended for people with known sensitivities to give them a heads up that should they get a reaction to a product, they can take that product to their dermatologist and show them the INCI list and say, I've used this product. I think I've had a reaction to it. I'm normally sensitive to this. Please help me. That was what the INCI list was invented and put on the product for. That has become a total travesty, and we're now demonizing individual ingredients, looking for their presence and absence, completely outside of the context of formulation. And if I can leave one thing as a message from this panel, it would be that an ingredient is not a formulation, is not a product. When you look at an INCI list and you see an ingredient, it tells you very, very little about how you are going to react to that product. And to all the people on social media going out, holding INCI lists into the camera and saying, I don't like this product, it contains X, Y, Z. Please stop doing that. Please. Thank you.
Mic drop.
No, I have to admit that as a consumer, like on an early stage, I am guilty of that, like just judging the product by the ingredient label, but just working with the chemist has allowed me to see that, you can cook with the same ingredients and the output could be totally different. If I was giving the same ingredients as Gordon Ramsay has given, like the output would be significantly so different. And I think there needs to be some sort of a shift to consumers that ingredients really only tell a very, very fragmented view of the entire product. So that's what I wanted to piggyback off of Anke and Jennifer as well. Another myth that I would like to point out is that everything that you apply topically gets absorbed. I think there's a really like there's a 60% of something that gets absorbed that is very well quoted by a lot of green beauty focused retailers. And I don't know who actually created that number of 60%. Like we'll be probably drowning in water if we do take a bath or a shower.
Exactly.
So, I would love anyone here to elaborate that or explain that.
But we need hypodermic needles to get things into our system. We administer drugs by ingesting them or applying them on other areas other than the skin to get them into our system. It is really, really difficult to get things to penetrate into the skin and then permeate through the skin into the deeper layers where the blood vessels are, and then from there diffuse and get absorbed into the bloodstream. So when we're saying things are absorbed into the skin, that is, you know, possible when we're talking about the stratum corneum, but the stratum corneum is just the top layer. That's not your skin. And for things to show up in your bloodstream, things need to, after penetrating, so just entering into the stratum corneum, they need to make a long, long way. They need to find the blood vessels and they need to get there without actually being altered and changed already by the system. The body is incredibly effective at changing molecules so that they can get out of the body again and be detoxified. Not going further into that, but you know, before things can actually show up in the blood, a lot of things have to happen. It's incredibly difficult to actually get substances into the bloodstream. So there are substances that can be delivered, but there's a long, long, long list of properties that these substances need to check the boxes for. Molecular weight, they need to have a certain partition coefficient, so they need to have the right balance between blending with oil and blending with water. They need to be charged or not charged at physiological pH. They also need to be there at the right concentration. They need to diffuse. It's a very, very long story, and a lot of pharmacists work very, very hard to actually get substances into you when they need to be there. That's why we need to often use hypodermic needles, infusions, injections, when stuff needs to show up in the blood effectively, because the skin is so difficult to get across. I'm really sorry I interrupted, but this is so close to my heart.
Wow, thank you so much.
I would go right on board with what Liah and Anke said. I mean, I've sometimes posted on social media pictures of me recently in office, and I really, you know, dressed like Darth Vader. And if I could just sort of somehow put something on someone's skin and not have to touch them or inject or do one of the 80 things we do to get things in, I could wear a lot less protective clothing to the office. So I would like to really, that would be a great myth to dispel. There are just so many, but the ones that kind of top of mind for me, Liah, again, I think you touched on it earlier, this idea that more is better, that somehow if you don't, you know, if you attack a problem, you shouldn't just attack it. You should, you know, the analogy, again, I love analogies. The analogy I give is, you know, you can put a pair of pants on with a button. You can put on a belt. You can put on suspenders. You could physically have a person holding up your pants. You don't need all of these things at the same time, because all you generally do is create other problems. So you have to give the things that you believe will work a chance to do it. That goes along with the other myth of things work overnight. They do not. Because it takes this effort to penetrate into the skin, you need to respect that ingredients have to react, sometimes have to be transformed. Most ingredients under the proper conditions will work. And I will say that seeing patients, it's very much people come and blame the ingredient. And often when we do that detective work together, what we find out is it isn't really always the ingredient. I was putting it on with this, or I put it on with this, or I put it on under this, or I put it on top of this. And when we figure that out, people are often surprised that we don't need to change the product. The product is fine. It's just not being used properly. So my plea, if Anke's putting out pleas for, you know, loving remembrance, please don't try everything all at once. It will not get you to your actual destination faster. Chances are it will slow you down because you will encounter problems as a result of it. And number two, when you find that right combination for you, please give it a chance to work. Almost always it will.
Who wants to go next, Eunice or Andy?
Yeah, I'll just kind of piggyback off what Ranella was saying actually as well, because another myth that I've kind of seen more recently is that all cosmetic skincare is the same and that none of it really works. And actually, I think that whole myth comes from the fact that people are either using the wrong thing or they're not giving it time to work. So then they'll hop from product to product to product, and then they'll just kind of, and each time they use something that hasn't worked, it's confirming their bias more and more each time that actually nothing's working, and it's really just because they're not giving it enough time to actually work. So then they kind of throw everything out and just think, well, actually none of this is working. So yeah, that's another myth that I kind of just come across from more recently.
And I'll hop in and say that one of the myths is centered around preservative systems and the usage of parabens. Last week, I actually talked about that for a group called Painted Pink, and they were, they target women or young women of color concerning breast cancer. And that's one of the things that I told them, hey, the study that all of these brands are using to state that parabens are dangerous, they used a very small sample of people to test. And I relay that there is importance in knowing that you need a preservative system in any cosmetic or any skincare product that you create, because it helps to protect from microbial growth within the product, and it also protects you as a consumer. And so that is one of the myths that I like to dispel, is that you need preservative systems like parabens or whatever other preservative systems that are out there. You need those in your products. And studies have shown that parabens are very, very great at being able to preserve products. And the studies have also shown that they have not caused any harm to any consumers. It really takes maybe even a large percentage to probably even see some sort of effect of that nature. So I always tell consumers that you need a preservative system in your product, and not to be scared of parabens or any other preservative system.
And maybe just to add like one more point, I saw this in the comments. People were talking about like the EWG, is it reliable? I have a whole post on this, so no. I also
No, it's not.
if you want
It's
more
not.
on clean beauty, we did a whole, I think it was hour and a half, I think it might have even been longer, panel. Anke was on the panel, as well as 3 other scientists. So if you want to hear more about that movement and maybe the pseudoscience that underpins it, then go listen to that panel. And this is this assumption that natural ingredients will be safer, and that is just not true. It's just not true. If anyone wants to like add to the reasoning for why natural isn't always better before we move on to my final question for you guys, Anke, do you want to add to that point?
Yeah, well, it's really easy to, assume that natural is better, because if it's grown somewhere and Mother Nature has made it, it just gives you that warm, fuzzy feeling that it might not harm you. But actually, some of the strongest poisons that at very, very low concentrations are toxic to the system. And mind you, I'm using concentration and the word toxic in the same sentence, because talking about toxicity without talking about concentration doesn't make any sense at all, because everything can be toxic when used at the wrong concentration. Even table salt, when eaten at too high amounts, can give you, cerebral edema. Your body just holds on to water, and you literally die from eating too much salt. You need to eat a lot of salt, but it happens. And same applies to everything. And since it applies to everything, it also applies to natural substances. And coming back to what I said earlier, some of the most at low concentrations, very low concentrations, toxic substances are actually natural. They can be used safely. if they're used at very low dosages. And then they even have medical benefits, and a lot of traditional drugs that are still used as medicines are actually coming from that background. But it's just not right to say natural is better or natural is safer, because what it boils down to is what concentration are you using and for what purpose? And also in what formulation and how often and where do you apply it and what is it good for? So that's one aspect of it. And then there's also the whole natural is better for the planet, because when we synthesize things in the lab, we're using, organic chemicals or petrochemicals, and we're using a lab machinery in all kinds of fields artificial, and that can't be good. But if you look at individual cases, farming ingredients, harvesting ingredients, processing ingredients, extracting ingredients, purifying ingredients, and then stabilizing them. Coming back to what Liah said about high cost vitamin C serums, if you were to use a stabilized vitamin C derivative that has gone through that whole chain from farming, harvesting, processing oranges to get the vitamin C out of it, and then stabilizing that vitamin C into a form that you can use in a cosmetic product, you will have used so much energy and so many resources that just synthesizing that stable vitamin C derivative in a lab will be way more sustainable and probably even more effective for you as a consumer. So natural is better, just doesn't work that way. It depends on the case-by-case scenario. It's a 360 view that you need to get on your ingredient and on your product for you to be able to judge. It's just complex.
And the two things dermatologists always like to bring up, that poison ivy is about as natural as it gets. And anybody who wants to rub around in it and make the point, knock yourself out. The other thing I was going to say is we just, a wonderful science educator, Charlotte Palomino, and I just had a post on bakuchiol, which is the ingredient du jour in dermatology. And, the really frustrating part, we break it down in great detail in the post itself, but, and we took apart the study, but the little part that people were so taken by, which was the end part of our posting, was what it has done to the environment, to the ecosystem, to the people whose lives were built around this plant. If it were just as easy, that it were only so easy to find a plant and have that plant be the solution, be all, end all. Every product that you use in life, eat, or on your body is processed. And that is not a bad thing. The word synthesis at its core means to take something small and to build it from smaller components into something large. I do not know how that word has now been taken to have an evil meaning. It is really a scientific word, and it is really a terrible thing that we have allowed this conversation to just happen without any input from the people who are spending their lives studying, working, regulating. If we could have just a respect for the fact that these things are regulated, protected, and safe, and then understand it is a reasonable conversation for people to say, I prefer not to do something that comes from X environment. I'm a vegan. My job is to help you with your beliefs. I'm not looking to convince anyone to follow my belief structure. That's not my job. My job is to respect your belief structure and help you find your best solutions. But please take the moment to respect and understand the science before you create that belief structure. And then together, everyone on this panel wants to work with you to get you the outcome that you like and that works with what you believe.
Now, just to wrap up these myths, I just wanted to add one more thing, because there was someone in the comments talking about, well, what's the problem with just taking a cautious approach and not using parabens? And I thoroughly disagree. I just want to put it out there. And if you want more details, I have a whole post on this, and go check out that Clean Beauty panel that we did. But I thoroughly disagree that paraben free is the cautious approach, because when you look at like studies, safety data that we have for parabens, contrast that to other preservative options, they are at least from what I understand, and Anke, correct me if I'm wrong, the most substantiated for safety preservative option that we have so much data at this point to demonstrate safety. And it's not only that one point, they also can be used at low levels. They have very good skin tolerability compared to some of the other preservative options. And I'm not going to demonize other preservative options, but I just thoroughly disagree with, well, what's the problem with just taking the cautious approach? I just don't see how, when something has less data, that would possibly, in what world is that the cautious approach? But I'm just going to leave it there because obviously we can take this on a whole nother tangent to this conversation and spend the rest of this conversation talking about parabens or clean beauty or natural or whatever other fallacies there are about skincare. So if you want more detail, then go check out that post or the panel. And my final question to you guys: what are the top skincare tips that you'd like to leave with our viewers? Eunice, do you want to start?
Sure. I am going to focus in on skin of color because that is an area where a lot of brands or consumers, there's there's not a lot of information, but it is growing. So when I say skin of color, I'm including people of African descent, Middle Eastern, Asian, Pacific Islanders. All of those persons are considered persons with skin of color. And so I would leave that with a tip for those who have skin of color to realize that one size doesn't always fit all. And so be really specific in understanding what your needs are. And typically the top issues for persons with skin of color are hyperpigmentation and acne, according to the Centers of Disease Control. So you want to make sure that you're looking for products that address those issues, such as hyperpigmentation, and that will help you to even out your skin tone or get rid of any of the dark spots. And so that will be the tip that I would say is important, that for a person of color, really consider those hyperpigmentation and look at, utilizing some of the AHAs. Mandelic acid is great for skin of color because it's such a large molecule that it doesn't irritate our skin as much. And then also the importance of using hydrating ingredients for our skin because we tend to have very low ceramide levels.
Andy, do you want to go next?
Yes, I think my number one tip would always be, wherever possible, go to see a facialist or a dermatologist to get a better understanding of your skin. Accurate diagnosis of your skin type and being able to have a routine that actually suits your skin better can save a lot of hassle in the long run. And then the other tip that I would like to leave people with is just to be have a little bit more of a respect of the epidermis and have more of an understanding that actually, the skin is not a piece of dead wood. We can't just kind of keep sanding it down and hoping that there's going to be better skin underneath somewhere, because actually a lot of problems that I know I see, and I'm certain that Ranella sees as well, a lot of the problems that we see are actually created by over exfoliation or using the wrong thing in the first place. So we can have more of an appreciation for what our skin actually needs and more of a respect that actually it's a living organ that we're dealing with. It will save a lot of hassle and problems in the long run.
Who wants to go next?
I'm happy to. Spend your money wisely. Skincare is an incredible thing. So try to think, where are the products where I should put that budget dollar that will really get me where I want to go? Spending a little bit more on a wonderful sun protection product is going to be money well spent. Or as I sometimes like to say to patients, you can spend $12 on sunscreen or add a few more zeros and spend it with me.
Anyone want to go next?
Yeah, I'll go next. I think for me, it's always been, instead of following all of these trends that people do see on YouTube, on Instagram, and all that, the to-dos and not to-dos when it comes to skincare, I think the number one skincare tip that I always told myself that throughout my that helped my health, that helped my skin tremendously was to trust my skin a little bit more and give credit to what an incredible organ it is. And conversing with the skin, doing skincare more intuitively and more intentionally. And this is not to discount the need of professional experts here in this room, but I am noticing that a lot of consumers out there are overcomplicating things and feeling like they need a million different products in order to have a really healthy and flawless skin, because the industry and the marketing has taken it a little bit too far. So we feel like we need literally everything out there in the market to keep up with the beauty standard. And I think it's kind of same with the diet fad, where you see keto diet being a thing, a Whole30 being a thing, and then you try a bunch of different diets without knowing what really sits and fits well to your body type and the biology and the physiology of the body. I think the best thing is to listen to your body and practice intuitive and intentional eating. And I think that can also translate very well to practicing skincare. So I just want to uncomplicate the world of skincare.
And then last but not least.
Yeah, I was going to say, just my tip would be relax. I think we've probably hyped ourselves up quite a lot about skincare, not to discredit it's important. And it is very, very important. But I feel that there is a lot of, comparing your own skin to other people's skin, and what do other people put on social media as their skin, which not often it is, because they're using filters and image alteration. So I would say take a step back, stop looking at too much at what other people's skin looks like. Your skin is your skin, and that's what you see in the mirror. And chiming in with what Liah says, get a feeling for what your skin needs, what it looks like, and don't overcomplicate things. If you feel like nothing works for you, really go see someone like Andy or Ranella. Get an expert to look at your skin and tell you what your skin is like and what is good for your skin. But most of all, relax. Cosmetics, especially the ones from the drugstore, I would say, are there to be enjoyed. You're supposed to feel good in your skin, and stop aspiring to have somebody else's skin.
I think that's a great point for us to end on. So thank you everyone for tuning in. Thank you to all of our amazing panelists. Be sure to check out all of our panelists on Instagram. They put up really great content, also on YouTube. Most of them at this point have come on my podcast. Ranella, stay tuned. We have to do an interview, but you can expect to see an interview from Liah and Andy on the next season, which is being launched in 2 weeks. We do have a podcast. If you like this panel, I'm sorry if you can hear my cat. She's hangry outside the door right now. You might not be hearing her, but she's been meowing outside my door for the past 20 minutes. But if you like this panel, we have a lot of other panels up already. So we do have a panel on clean beauty. We have a panel on nutrition, on hair care, on agriculture. The next panel up is going to be a month from now on fragrance. I guess this is like the great debate of 2020 in skincare. So if that's a topic that you're interested in, then tune into that panel. It's also free to tune into. So we will be publishing the event tomorrow, so stay tuned for that. But thank you again for joining us, and thank you to all of our panelists. This was such a great conversation.
Thank you so much, Jen.
Thank you.